Everyone, my name is Sharda Mobir. My topic for today is increasing the number of medical assistants in clinics would enhance efficiency and reduce burnout among nurses and physicians. Today I want to talk about an issue that affects every corner of our healthcare system, an issue that impacts patient safety, staff well-being, and the overall quality of care. That issue is burnout among nurses and physicians. We hear about it constantly. Long hours, overwhelming patient loads, and the emotional weight of caring for people during their most vulnerable moments. But what we don't talk about enough is one of the most effective practical solutions already within reach: increasing the number of medical assistants in clinics. Medical assistants are often the first and last point of contact for patients. We take vital signs, prepare exam rooms, handle administrative tasks, support procedures, and keep the flow of the clinic moving. Yet, despite the essential nature of this work, many clinics are still understaffed, leaving nurses and physicians to juggle responsibilities that could easily be delegated. When highly trained providers spend their time on tasks like rooming patients, updating charts, or managing phone calls, it pulls them away from what they're doing best: diagnosing, treating, and educating patients. By increasing the number of medical assistants in clinics, we can dramatically improve efficiency. Imagine a clinic where every patient is roomed on time, where charts are updated accurately, where providers walk into the exam room fully prepared with all the information they need. That kind of workflow doesn't just happen by accident. It happens because medical assistants are there to support the entire care team. When MAs handle routine, clinical, and administrative tasks, nurses and physicians can focus on higher level responsibilities, which leads to faster appointments, shorter wait times, and a smoother experience for everyone involved. But efficiency is only part of the story. The deeper issue is burnout. Nurses and physicians are leaving the field at alarming rates, not because they don't love their work, but because the workload has become unsustainable. Burnout doesn't just affect the providers, it affects patients, families, and the entire healthcare system. When clinics are short staffed, mistakes increase, morale drops, and the quality of care suffers. Adding more medical assistants is one of the most cost effective ways to reduce this pressure. We can take on the tasks that drain time and energy from nurses and physicians, giving them the breathing room they need to provide safe, focused, compassionate care. And let this be clear: this isn't about replacing anyone, it's about strengthening the team. Healthcare works best when every member is supported and be able to work at the top of their training. Medical assistants are trained, capable, and ready to fill the gaps that slow clinics down and overwhelm providers. When we are fully utilized, the entire system benefits. Increasing the number of medical assistants is not just a staffing decision, it's a strategic investment in patient care, provider well being, and the future of healthcare. It means fewer delays, fewer errors, and fewer exhausted nurses and physicians trying to do the work of three people. It means a more balanced workload, a more positive environment, and a team that functions with confidence and clarity. So, today I'm asking you to consider the real impact of expanding medical assistant workforce, not just for the sake of the efficiency, but for the sake of the people who dedicate their lives to caring for others. When we support medical assistants, we support the entire healthcare team. And when the team is strong, patients receive the high quality care they deserve. Example, wait time 47 minutes. Nurses juggling, rooming, taking vitals, taking phone calls, and charting updates. Physicians spend 1 to 1.5 extra hours on administrative tasks. Adding more medical assistants, wait time reduced to 38 minutes. That's 20% improvement. Thank you.